So what I'd like to do now is turn to the members of the roundtable to introduce themselves. Now, this is an open session, so I imagine we've got the speakers and the roundtables mixed in this audience here. And I want the speakers to pass because we're going to introduce you here in a second. So if you're not actually point of the roundtable, just pass, if you will, and then we'll go, and then we'll come back. So we only have a limited amount of time for introductions at this point. So if you'd say your name and where you're from, that would be terrific. And as we later today, we'll actually have an opportunity for more extended introductions to each other when we sit down to do some of our work. So.
Good morning, everyone. I'm Mary Lou Key, and I'm with United Way in Santa Cruz, California.
I'm Peggy Anna Ray with the Office of the Assistant Secretary for Health, HHS.
I'm Andrew Ryan, Policy Director of the Center for Disease Control and Prevention.
Sandy Magnan from ICSI, Institute for Clinical Systems Improvement in Minnesota.
Hi, I'm Phyllis Meadows from the Kresge Foundation and University of Michigan School of Public Health.
Good morning, Paula Lance from George Washington University.
Morning, Jose Montero, New Hampshire Department of Health and current president of ASTA.
Martha Gold from the City College of New York and visiting at the New York Academy of Medicine this year.
Pamela Russo from the Robert Wood Johnson Foundation.
I'm Jim Nickman, president of the New York State Health Foundation.
George Flores, the California Endowment.
I'm Andy Weber with the National Business Coalition on Health here in Washington, D.C. Welcome to beautiful Washington in the springtime.
Good morning, I'm Sarah Linda. I'm the Chief Public Health Officer at the Health Resources and Services Administration.
Good morning, Judy Monroe. I direct the Office of State, Tribal, Local, and Territorial Support at CDC.
Good morning, I'm Ray Baxter from Kaiser Permanente.
Morning, I'm Lila Rutten with Mayo Clinic.
Good morning, I'm Brian Sakurada with Novo Nordisk.
Good morning, I'm Michelle Larkin with the Robert Wood Johnson Foundation.
Good morning, I'm Bob Hughes from the Missouri Foundation for Health.
So we got that, yeah, I know. So that would be, you know, if you were listening to the introductions, that would be a very distinguished group of people that we're going to have a chance to work together with to try to achieve some real change. Now, we have the good fortune to be supported by, I think, the first A-team here at the Institute of Medicine. This staff that we have assigned to this project is outstanding. And Rose, I'd like you to begin with your own introduction and introduce yourself, and I want the other staff, as well as Alina and the others, to introduce themselves as well. So if you could bring the microphone over to Rose.
Good morning, and thank you all for being here. I'm Rose Martinez, and I direct the Board on Population Health and Public Health Practice here at the IOM.
Okay, Alina, back in the back there.
Alina Bakshu, Senior Program Officer at IOM.
And the rest of the staff?
Step out for the moment.
Hi, I'm Drew Lemmerich, Research Associate at IOM in the Board on Population Health and Public Health Practices.
I'm Colin Fink. I'm a Senior Program Assistant on the Board of Population Health and Health Practices.
And Lila?
And Lila Hernandez is also, she's a Senior Program Officer at IOM.
So the staff is wearing, you'll notice they have, I think, different colored name tags, green name tags or something like that, I'm told. But if there's any issue or question that you have during the course of the day, you know, make sure that you make them aware that you need something. We've got another introduction here.
Good morning, I'm Debbie Chang with Nemours. I'm on the board of the
Good. The materials that have been sent out include complete bio sketches of everyone. so that there's a more in-depth and detailed set of materials for people to look at and become familiar with. So at this point, we're ready for our presentation, but Harvey is not here at this point. Is that right? Okay, so we'll move to the panel. So I'll turn to David.
Okay, so when Dr. Feinberg arrives, we'll find a way to have him kick this off. But you know, and that's actually an important sort of introduction to our work. But what we're doing here this morning in this public session is to hear a number of important perspectives from different sectors about the path to improving population health. I mean, there's, you know, a few years ago, there wasn't that much going on. I mean, a decade or so ago, right? I mean, there were a few lonely voices out there. But the last 3 to 5 years, there's been just an enormous burst of thinking and activity and policy recommendations and reports, you know, like from here at the IOM. And we thought we'd take this opportunity to get some public thoughts and reflections and perspectives on where we stand. And actually, so for those of you not on the roundtable, after this morning's session, we're going to spend the next 2 days here actually planning our work for the next 3 years, the whole series of workshops. I mean, we're going to have 4 to 5 or 6 workshops a year, commissioned papers, issue briefs, communication strategy. We'll be planning that. So the purpose of the morning session is to sort of set up that activity. So, so we'll start. And maybe this is going to be webcast, and so probably we'll have each of the speakers come up here. I don't know if there's a particular place where they need to sit, but we're going to start with Steve Teutsch, who's the Chief Science Officer of the LA County Public Health Department. He works on evidence-based public health and policy. He was vice chair of the recent IOM committee that offered a trio of consensus reports on public health, concluding with the 2012 report that many of you are familiar with, for the public's health, investing in a healthier future. Dr. Teutsch.